Joining us now is Dr. Allison Bartlett. She's a pediatric infectious disease specialist at University of Chicago Medicine, Comer Children's Hospital. Thanks for being with us.
Glad to be here.
Let's start first with this vaccine recommendation. I think there's a lot of confusion about what's being recommended at the federal level, what's going on here in Illinois, and really what parents should do.
I think you've highlighted a really big concern, right? We used to have a unified national evidence-based recommendation for how to handle childhood and adult vaccinations. And over the past year, we've seen sort of the erosion of our public health system. And now, unfortunately, we're leaning on states and professional societies like the American Academy of Pediatrics and our infectious diseases societies to help continue to make evidence and science-based recommendations for vaccines, leaving parents in a confusing position.
So some of these that they're saying they don't need vaccinations for anymore, talk about RSV, hepatitis A and B, some forms of meningitis. All kids were getting those as infants?
Correct, with the exception of the RSV vaccines or immunoglobulins, which is a brand new revelation over the past 2 or 3 years for newborns, which has transformed the number of children that are admitted to the hospital for a very serious condition. So that was a very new, exciting development that I'm sad to see sort of the CDC walking back their recommendations on. But all of the rest of the vaccines are indeed recommended for all children.
Flu A is a big deal right now. What can you tell us about flu A, how it's different than normal flu, and is it too late to get a vaccination?
Great question. So flu A is normal flu. There are two kinds of flu A and flu B. Flu A is generally this time of year. Flu B will probably come in February, March. So the important piece is it's not too late to get vaccinated. It takes a week or two before the vaccine gives you full protection, but we are seeing a rapid increase in the flu A cases over the past month. And with people having been home for the holidays and kids now being back in school, I expect it'll go up even more.
Why are we hearing about this affecting children so much?
It has always been the case that flu
So it's not unusual.
It is not unusual. The sort of under 2 years old or under 5-year-old groups have always been one of the highest risk for complications from the flu.
What about, sorry, go ahead, Larry.
No, when people say, well, you know, how effective is it? It's not 100% effective, so therefore I'm not going to get it. What do you say to those people?
They are correct. It's not 100% effective. It ranges about 50 to 60% effective per year of preventing serious illness and hospitalization. And 50% is much better than 0% effective. If there's something that I can do that is safe and proven has minimal side effects that can prevent me or someone I love from having a serious illness, I'm going to go ahead and do that.
Are people right to have some skepticism about some vaccines, or what is your recommendation as a doctor?
That's a great question. So I am unequivocally pro-vaccine of all kinds. There are incredible lengths to which the science has to be proven that these are safe and effective, and they are important both individually for my own health, but more importantly for the health of the community and people around me who may be unable to receive vaccines.
All right, Dr. Allison Bartlett, thanks so much for joining us. We appreciate it.
You can find more information on the hospital's website at uchicagomedicine.org. Thank you.
Thanks again.